Hi, I'm Chris Tapley. I am our physical therapist here at Mott Children's Hospital as part of our CF Center. We are going to talk today about doing percussion and vibration, or airway clearance. We are going to work with Palmer and her mom to go over the best techniques for it and how we do it. Airway clearance is really important to help clear secretions within your lungs, and that can be for a variety of reasons. For individuals with cystic fibrosis, it's extremely important to clear those secretions, but it can also be for anybody with any kind of respiratory concern. So the technique that we're going to do today is percussion and vibration. You'll also hear it called percussion and postural drainage, chest BT, a lot of different names, but it's a technique where we're going to use clapping on Palmer's chest to help move those secretions and help her to clear those secretions out of her lungs. So we'll go ahead and get started here. So Mom, what I'm going to have you do first is just let Palmer lean back against your chest, and we're going to take, and we're using today a percussion cup to kind of thump on Palmer's chest. And when we're doing that, if we're over her rib cage, we're going to be over her lungs, and that's what we want to do. So the pace that Mom's going is great, and we want just a nice firm tap on it. Usually for our younger kiddos, we'll say I want a little bit of a cheek jiggle, but this is perfect for Palmer. And then as Mom does it, I'll have her move her hands kind of back and forth across her chest so we get both sides. If your baby's a little bit younger, we kind of get both sides all at one time. For Palmer, since she's a little bit bigger, we want to make sure we get both right side and left side of her lungs. So as you can see, Palmer is a little bit of a wiggle worm, which is great. We want that. But sometimes it becomes hit the moving target, and that's okay. So I'm going to show you 5 different positions, but sometimes we do the best that we can with those positions. So Mom, I'll have you go ahead and lean Palmer forward now. That's perfect, just there is great. So she doesn't have to be leaned forward that far. The different positions for percussion, what they do is they help the lungs expand slightly differently in those different positions, which helps with the airway clearance, helps move those secretions. But like I said, at this age, we don't necessarily have to have all of the positions. Better to get the percussion than not. And we're looking for about 2 to 3 minutes or so in each position. And we want to do about 5 different positions, so we're looking for about 15 to 20 minutes total of percussion. So perfect. So the next position we'll try is have Palmer lay on her back, kind of across your lap. And again, kind of good rule of thumb is right over her chest or rib cage. So, that's okay.
It's okay.
And we can go ahead and go to that last position, one of the last positions, right over on Palmer's tummy. And so we'll do that percussion right on her back there. And then the last position that we do like to do is just laying on her side if she'll let us. And that's one of those ones, especially for our younger kiddos, is a great position that we can do. Sometimes as the kiddos get a little bit older, they don't like that one as much, and that's okay. And that's that position there. As you saw with Palmer, we move her around as she's not tolerating a position. I don't want this to be something that she hates, that she doesn't like, because then nobody's going to like doing it. So just moving around, finding what works, finding distractions are things that we want to do. Sometimes we want to avoid doing percussion is right after a child eats. It can make them throw up. In some cases, kids are fine, but we usually recommend at least 30 minutes after they eat to wait. The other things we want to avoid doing is I like to do percussion with at least a shirt or onesie on. Not right on bare skin. It's not very comfortable that way. And then finally, we just want to avoid over buttons, zippers, those sorts of things, so that just is uncomfortable and can cause bruising. So those are big things what we want to avoid with it. What you will notice is sometimes right after percussion, you will get some coughing. Sometimes you won't, and that's okay. This is really preventative maintenance is for the best description. It's to help keep Palmer's lungs nice and clear. It's going to help prevent any infections. So don't be frustrated if you don't get coughing, if your child doesn't bring up secretions, anything like that. That's okay, and it's actually normal. If you see changes where we're having significantly more than that than normal, it is a good time to let the clinic know so that we can check in as well. But thank you for listening today.